the HMOs, where they started to, instead of pay as you go, it started paying small fees where you can go as often as you want. And then from there, it escalated with a couple of other problems within the federal government, and am I cut off?
Ms. Gillen.
Yes. I think we can all agree that every Montanan and everyone in the United States should have access to affordable and quality health care. And let's face it, it's very difficult to think about having a healthy economy if we don't have healthy workers. And in Montana, 20% of the folks are uninsured. As I talk with people about the Affordable Health Care Act, when you go into specific provisions, I'm a mother and now I get to keep my 22 and 25-year-old on health insurance, so that means a large segment of the population is now covered. Also, the elimination of caps is particularly a good proposal. The reason being is that the #1 reason for bankruptcy in Montana over the last couple of years has been someone who had a medical situation and just flat out could no longer pay the bills. There are other provisions in that bill that are very helpful for women, and also no longer put insurance companies in the driver's seat. And so, while it may not be a perfect bill, my approach would be, we do need a healthy workforce, we do need a healthy economy. Elect me and I'll go to Congress and we'll work on fixing what isn't right, we'll promote what is good, and in the end I think it'll be win-win, and we will save money, because what we pay right now is very significant for those who are not insured.
Ms. Gillen, how would you pay for the Affordable Care Act? The price tag is very, very large.
Well, I think that there are some provisions. Currently, I've always been one to say that you have to pay. You can't assume that the transition will happen over a 10-year period, and during that time we will have savings in health care cost. Also, there are some significant provisions in there that are really what I consider Montana common sense provisions that don't eliminate benefits, but speak to the administrative charges that are being charged by insurance companies. There are some other initiatives in there that in the long run will cover the cost. Mr. Daines referred to the Congressional Budget Office study. However, a nonpartisan group clearly looked at the benefits of this health care plan. And one thing it does, it focuses on Americans in Montana and not about jobs overseas, and that's a win-win for all Montanans.
Mr. Daines, how would you take care of those folks who are uninsured? If you repeal the Affordable Care Act, how do those people get insurance and get the care that they are lacking now?
I think key is to keep focused on the affordability question in healthcare. Healthcare costs keep rising. If we make progress in affordability, we'll make progress in accessibility. So I think that's going to be one of the key parts. And when I laid out the defensive medicine and having some tort reform is one way to help reduce costs. We need to look at how do we reduce costs and improve outcomes in our current healthcare system. I also think we need to be looking at investing in primary care. I had a great visit here, in fact, just recently in Missoula with one of the community health clinics, and seeing that when people get primary care, it's preventive in nature. And I think we need to put emphasis on prevention as well, so they're not having to have return visits to the ER room and so forth, because a bit of a cure there is certainly worth a lot more than the cost of prevention. So.
Right. How do poor people get that preventive care, though? Because those are actually the folks who you see going to the emergency room because they haven't been able to get that care they need in advance, so they end up in the emergency room where it's just the most expensive place to go.
Yeah, and I think it's a part of education, so we're to make sure they're providing other channels here for primary care other than the ER room at our hospitals. And I think these clinic partnerships are working with our hospitals right now, saying there's other ways, instead of coming to the ER room, which is a very expensive outcome, is to move to these primary care providers here in Montana. And that's one tangible way we can do that.
I would like now to pitch a hypothetical scenario to you all. Let's say, pretend, a healthy 33-year-old man decides he doesn't want to use his salary to purchase health insurance, but he does buy a speed bike. and one day he gets into a terrible motorcycle accident, but he survives, receives devastating injuries that will cost tens, if not hundreds of thousands of dollars to treat. Who should pay for his health care? And this one goes to Ms. Gillen.
Well, actually, under the current situation, in terms of a person who suffers a serious accident, doesn't have any health insurance, and has a long-term disability, there are already a couple of payers. Those include the folks at our hospitals. And actually, during the last couple of months, I've been involved in the legislature with a study on health care and nonprofit hospitals. And I'd like to point out that the hospitals have come to us and said, listen, we are experiencing double-digit increases in bad debt, people who can't pay their hospital bills, and charity care because of the number of people who are not covered by insurance. As this person would go on, unfortunately, they probably would be eligible for some type of long-term disability, Social Security and Medicare. So ultimately, as you pointed out, is that without robust and full coverage of insurance, is that the bill eventually goes back to the taxpayer. And that's what I think that the real, as we move forward, it's very important in health care that we increase coverage, we increase preventative care, but we have to face the reality that it has to be paid for. And right now, hospitals and taxpayers are picking up the tab.
Mr. Daines.
Yeah, well, there's a kind of a question too of accountability, but we have situations that are going to come up time to time here where there are tragic situations and so forth. I think this comes back to we're going to have a system here that is going to have the ability, working with both charitable contributions that our hospitals have played that role here certainly over the years in taking care of individuals who have not had the funds to afford a significant kind of medical event. So it's a difficult problem, but the answer does not lie here in putting that always on the backs of the taxpayers, so forth. And these challenges come up. We work together with our communities, our hospitals, and so forth. But my concern right now is that we're going to spend $1.9 trillion on Obamacare at the moment here that would provide that coverage, but the taxpayer eventually will bear that burden.
Mr. Kaiser.
You guys are looking for government to take care of this or to solve the problems. They are the problem. If we leave it up to the private industry and we get rid of the ball and chain regulations and let them get back to where we can get to the times when I was born and you had pay as you go. The private industry can fix things 100 times better than the government can. And so here we are having a discussion about how government's going to do it. Well, that's insane. They're the ones who created the problem with the regulations, with requirements on part of. So my answer is cut the regulations, give it back to the private companies.
Mr. Daines, you said we need a higher level of accountability. So many people are not accountable for their actions, as this gentleman would be in my hypothetical situation. And you also mentioned charity. So we dump these problems on the backs of churches. Did I read you wrong or no?
Well, I mean, I'm grateful that we have outstanding institutions across the state that typically our healthcare providers realize there's always going to be individuals in the system that can't pay the bill. And I think there's fundraisers, we have community events and so forth where the communities have to come together here for some who are very, the needy and the unfortunate in our society.
Mr. Kaiser, any feedback to that?
Yeah, there's 1.6 million nonprofit private charities in our country, and they have generated $561 billion in helping out communities for all sorts of different things. We've been doing it well before we had Social Security. And so, if there needs to be help within a community, that gentleman that got hurt, I'm sure he'd get his help.
Ms. Gillen, what do you say to all this?
Well, I will go back to the fact that we've just had a lot of reports from hospitals in Montana, urban and rural hospitals, that have come to the legislature and said, you know what, we are experiencing double-digit increases in charity care and bad debt, and